Hello, Lori. Welcome
Hello.
back. It is so good to see you again. We found your problem. Are you ready to take a look? Before we do that, I'm going to sit next to you. I want to make sure I got my notes right. All right. Now, you told me this low back pain and SI joint pain has been happening since a fall back in June. It actually travels down your left leg. Has not gotten any better. You've tried physical therapy, you've tried medications, you've tried NSAIDs, you've tried gabapentin, you've even bought a new bed, and all of this for minimal relief. Is that correct? This is affecting your ability to work out, to sleep, to walk, and it's even affecting your quality of life now. Isn't that true? And I think it's fair to say to this point that you haven't found a long-term solution, right? Now, before I go over your results, I want to show you what's normal here. Now, there's a few different structures that I want you to keep in mind. This is what we're looking at. This is a normal and healthy low back, and we're looking at it from the side, all right? Now, when we're looking at this, do you see these box-shaped structures? Yes? Those are the vertebrae of the back, all right? 2, 3, 4, 5, and all the way throughout. This is the tailbone. This is where you sit, okay? So, looking at this, this is the front, this is the back. The second structure, these are the discs. You see how nice and thick they are, and they look very nice and uniform throughout. The discs act as shock absorbers, all right? They help you move, they help keep the bones from becoming bone on bone, and they help prevent arthritis. That makes sense to you? The third structure is this hole. These are called foramen. You don't need to remember that, but what I want you to think of this as, this is the hole where the nerve comes out and goes to different parts of the body. So the nerve comes out of there and it goes down your leg to your knee. The nerve comes out of there and it goes to your stomach and intestines. Does that make sense to you? So now that you know what healthy and normal looks like, I want you to keep this picture in the back of your mind, all right? Lori, this is what yours looks like. What do you see?
The vertebra is not even the right shape it's supposed to be. There's not a lot of space in between. It just looks like it's pressing.
Exactly. Absolutely right. You're very close to bone on bone. You have this severe DDD. What does DDD stand for? Degenerative disc disease. Okay? Just like any other disease out there, you have inflammation associated with this. And just because of that, this problem is only going to get worse and worse and worse. Just like cancer, kidney disease, bladder disease, anything that you can think of, it's going to get worse with time. All right, and that's why it's termed that. So now that you know what you look like, now that I got a chance to review these, it made a lot of sense why you're having trouble going to the bathroom, why everything's getting worse, why you have so much trouble walking, why you can't enjoy your sleep, why you can't exercise anymore. All right? Now, when I see things like this, when I see an x-ray like this, when I hear everything that you've been telling me, it worries me because usually the people that tell me this are in line for surgery, right? And I don't want you to go through that whatsoever, all right? Now, looking at that, there's a couple of different ways that we can fix this. 2 routes. 1, we can take care of your symptoms. We can act as a Band-Aid for you, okay? 2, we can fix the problem as much as possible so this pain problem that you're having never comes back. Which one do you think is better?
I want my pain not to come back, so second choice.
Good choice, okay? That's what we can do for you. Now, the way that we're going to do this is through non-surgical spinal decompression, all right? We're gonna put you on the table that you saw in our ad, and it actually is gonna pump these vertebrae and pump clean fluid into the disc, and as it compresses, it's gonna push the bad fluid out, all right? That is what actually gets the disc to rehydrate. Okay, does that make sense to you? Now, with that being said, we also talked a lot about chronic inflammation. Don't you think it's going to be important that we address that as well while we're going through this? So after every session, you're actually going to get low-level light therapy. It's going to help you with your chronic inflammation, and it's going to help the disc heal in place. Sounds like a good thing, right?
Mm-hmm.
Good. A couple of other things. What we really need to do is attack this with supplements as well to get you feeling as better as quickly as possible. So with that, we're going to do NAC. It's a super antioxidant, creates a lot of glutathione in your body. Glutathione is just going to help you get rid of all of that chronic inflammation, bring down the pain, get you more function. Does that make sense?
Mm-hmm.
I'm also a realist. I understand that you're not going to get better overnight, right? So what I want you to do is take some of our pain creams. They're like Bengay on steroids, all right? One you're going to use throughout the day and one you're going to use at night right before bed, okay? I want you to apply a generous amount of that, okay? So going through that, that is what your treatment plan is going to look like here. For the first 4 weeks, you need to be here 3 times a week, all right? We'll do a re-exam after that so you can see your progress.
Okay.
For the next 4 weeks, you'll be here at 2 times a week. And then for 4 weeks after that, you'll be here at 1 time a week.
Okay.
Then we're gonna move into maintenance, all right? You're gonna be here for the next 4 months at 2 times a month. Now, this last page is just back care do's and don'ts. You need to be here for your appointments first and foremost, Miss Lori. I can't help you unless you're here.
Right.
I always try to take a 5 to 10 minute walk after every appointment. I can tell the people who go home and sit on the couch. All right, that's not gonna help and it's not gonna work anymore. This is going to be a two-way street now, all right?
Okay.
If you don't do your things at home, it's not gonna work as well. If I don't do the best thing for you here in the office, you're not gonna get the best results. This is all to benefit you. Quit sleeping on your stomach is another one as well, all right? We gotta take this seriously. It's only gonna help the upper back and the lower back, okay? All the rest of this, I know that you're involved and engaged enough with that you will take a good look at this when you go home, all right? Ashley, you've heard what Miss Lori is going through. It's affecting, this low back pain has taken over her life. It's taken over her body, going down her leg. It's debilitating. It's causing her problems to walk. It's causing her problems with sleep and with exercise. I don't know what the schedule looks like, but we need to get her started ASAP, okay? Miss Lori, once again, we have a problem that we can fix for you, all right? Ash is gonna go through the investment in money and time, and then that way you actually know what your options are, all right?
Okay.
Have a great rest of your day.
Thank
I'll
you.
be around if you have any questions for me.
Okay.
Okay.
Thank you.